Uh, Good evening, everyone. As we are all aware that 16th February to 28th February 20 is being observed as Swachhata period. As we are all aware that Swachhata is one of the top priorities of the government. Lack of cleanliness and poor hygiene. Sorry, good evening to all of you. Again, I just want to repeat my whatever I said. As we are all aware that 16th February 22 to 28th February 22 is being observed as Swachhata Pakhwada period. And as we all know that Swachhata is one of the top priorities of the government. Lack of cleanliness and poor hygiene is the leading cause of many diseases, pollution of water, bodies and environment, etc. Lack of cleanliness may also result in issues related to industrial safety. On this occasion, we have requested Dr. Umesh, Medical Division of BRC, and Dr. Gurpreet Kaur, Medical Division of BRC, to deliver a lecture on hygiene, and they are all here. Now I request them to deliver their lecture, which will be definitely useful for all of us. Thank you, sir.
Thank you, sir. Good evening, everyone. First of all, I would like to thank Honorable Vice Chancellor, Honorable Dean, Honorable Associate Deans, and all the officers and staff of HBNI for inviting us for delivering this lecture. I would also like to thank our overall in charge, Bantwal Madam, for supporting me in this lecture. So I'll start. Today's topic is hygiene, a key to healthy life. Now, what is hygiene? WHO defines hygiene as conditions and practices that help to maintain health and prevent the spread of diseases. Hygiene is a concept related to cleanliness, health, and medicine. So basically, hygiene means promotion of health and prevention of diseases. These are the two aspects of hygiene. Hygiene practices are employed as preventive measures to reduce the incidence and spread of disease. It requires not only caring one's own body, that is personal hygiene, but also taking proper care of surroundings, that is social hygiene. Now, the major aspects of personal hygiene which we will be covering are: first, cleanliness; second, physical exercise; third, rest and sleep; and fourth, healthy habits. In this lecture, I will be stressing on cleanliness and healthy habits, whereas my colleague Gurpreet Madam will stress on physical exercise, the role of rest and sleep for prevention of non-communicable diseases. Now, we know these terms, hygiene, cleanliness, and sanitation. We often use this term, but what are the real meaning of this term? Let us see. The term cleanliness should not be used in place of hygiene. Cleaning in many cases is removing dirt, waste, or unwanted things from the surface of objects using detergents and necessary tools. That means cleaning simply means removing of dirt. It does not involve removing of any germs. Whereas when we talk about hygiene, it means removing of germs as much as possible. Now, coming on to sanitation. Sanitation means the prevention of human contact with waste for hygienic purposes. It also means promoting health to the prevention of human contact with the hazards associated with lack of healthy food, clean water, and healthful housing. The control of factors, that is living organisms that transmit diseases, and a clean environment. So this is the definition, but what sanitation exactly means is promotion of proper disposal of waste materials so that prevention of diseases take place. Now, when we are talking about promotion of health, what does health mean? The WHO definition for health is the state of complete physical, mental, and social well-being, and not merely the absence of disease. If you look clearly at this definition also speaks about social well-being. Therefore, without social hygiene, we cannot achieve healthy state of mind. So, health means proper functioning of the body and the mind. Disease is a departure from normal health to structural or functional disorder of the body. It is a condition in which the normal functioning of the body is disturbed. In simple terms, disease means not at ease. If we are not at ease, we are having disease. Now, what if we remain unhygienic? So, diseases which are caused due to unhygienic conditions are infectious or communicable diseases. Now, these diseases are defined as disorders caused by organisms such as bacteria, viruses, fungi, or parasites, which can be passed from person to person. Now, these are transmitted by insect or animal bites, or are passed by consuming some contaminated food or water. Now, how these diseases spread? What is the mode of transmission, or how do the germs spread? These are the ways. First, direct contact. Coming into direct contact with saliva, mucus, blood, or feces that contains germs. Examples like skin diseases, fungal infection is a classical example. Conjunctivitis is also one example. Indirect contact, coming into contact with areas that have been contaminated. We'll look this in detail in the next slide. Vector-borne. Vector-borne means any mosquito or any animal like dog bite is there, and we get disease like dengue, malaria, rabies. This comes under vector-borne diseases. And food-borne and water-borne. This is due to consumption of contaminated food or water, we can fall ill. And droplets and airborne infection. This is important in COVID times. What happens is there are tiny particles which get suspended in air when we either cough or sneeze. Now, these tiny particles, if they are less than 10 microns, they are suspended in air and they are carried away by the air current. And if they are less than 5 microns, then they can directly get lodged into our alveoli and lungs. So COVID-19 is a classical example of this droplet infection. Now, contact transmission in indirect way. When germs from an infected host or other source are passively transmitted to another person via an inanimate or a non-living object like surfaces, keyboards, mouse, telephone, mobile phones, utensils, cups, toothbrushes, razors, all these items, germs are transmitted by non-living things. And a study was done last year in United Kingdom, which showed that the mobile phones which we use are 7 times more dirtier than the toilet seat. Can you imagine? Mobile phones are 7 times more dirtier than the toilet seat. Imagine when we use mobile while having a meal, or when we use remote of a TV while having meal, these germs can indirectly enter in our body. So while eating or having meals, we should concentrate only on having meals, and we should not interfere with any other gadgets or objects. Now, to simplify, what are the 5 F's of indirect transmission? First is food. As I told you, due to consumption of contaminated food and things. Fingers. Our fingers may be dirty, unhygienic. They can transmit disease. Feces. Now, these feces can contaminate food and water, and we get food and waterborne diseases. Fomites. As I talked about, the non-living objects which are there, they can transmit diseases. Flies. Flies means not only flies, but any living vectors like rats, cockroaches, dogs. These can transmit diseases. Now, to prevent these diseases, we need to have what is known as personal hygiene and social hygiene. Now, let us see at the definition of personal hygiene. Personal hygiene is defined as a condition promoting scientific practices to the self. Everybody has their own habits and standards that have been taught from childhood. What I think is that personal hygiene is not something we learn. Rather, it is imbibed on us from childhood. We do have many kindergarten rhymes which emphasizes the importance of personal hygiene. So basically, personal hygiene involves maintenance and cleanliness of our body and clothes. The most important thing in personal hygiene is hand wash. And in COVID times, this has got utmost importance. About 5,000 germs live on our hands at any given time. Germs and pathogens are easily spread through touch, and they easily get transmitted through our hands. Most bacteria on our hands is on the fingertips and the nails. 80% of communicable diseases are transferred by touch. Washing our hands can take just 20 seconds, but it can prevent as many as 200 diseases. Hand hygiene, therefore, is the most effective way to prevent the spread of infectious diseases. So school children, those who are watching this presentation, this is very important. Washing your hands regularly will prevent around 200 diseases. Now, wash your hands with soap and running water when hands are visibly dirty. Obviously, then we wash our hands. But if the hands are not visibly dirty, then what to do? Frequently clean them by using alcohol-based hand. That is what we call as sanitizers or soap and water. Now, when to wash our hands? Obviously, after coughing or sneezing, when caring for the sick, before, during, and after preparation of food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. Now, how to wash our hands? This is a simple technique. First, open the tap, then pour the liquid soap into your palms, then rub both the palms, then dorsum of one hand with the help of the palm, rub the dorsum of the hand, then vice versa, then interlock the fingers and rub in between the fingers and vice versa, then clench your feet and the back of the fingers should be rubbed against the palm or right fingers with the left palm and then vice versa. Then thumb cleaning by rotation of thumb with the help of one hand and then vice versa. Then the palm should be cleaned by placing your fingers and then doing a rotation and anti-clockwise direction and this can be clean. Then wash your hands under tap water. And while washing also, while cleaning and making it dry, use a separate towel or a tissue paper if you use it. You dry your hands and with the help of same towel or tissue paper, close the tap and then discard the tissue paper. Then your hands are safe. Now coming on to bathing. Bathing or showering should be done at least once a day. The entire body should be clean, including private parts. Make sure sweaty areas such as armpits are washed thoroughly. Children should pay attention that when you do some exertional sport and when you have sweated a lot, then there is a time to take a shower. Do not share bar soap or your towel. Dry off thoroughly. Bacteria can multiply on a moist towel and infections can spread rapidly. Skin should be patted dry, not rubbed, so as to lessen irritation and so there is some water retention on the skin. This water retention is useful because it helps in glowing of the skin. Now coming on bad breath or oral hygiene. Poor oral hygiene often results in bad breath. Brush your teeth every meal. After every meal, if it's not possible, at least rinse your mouth. Brushing should be followed by flossing and then rinsing. Flossing removes food trapped between your gum lines that rinsing and brushing miss. Use a soft or medium bristle brush and replace it every 2 to 3 months or whenever it gets damaged, if it gets damaged earlier. Use a toothpaste that contains fluoride. Now this is important. In a city like Mumbai, the water doesn't contain fluoride. So use of fluoride toothpaste is necessary. Whereas in Maharashtra, there are around 7 districts. Those are in Vidarbha and Marathwada, wherein the water contains fluoride. There you cannot, if you don't use fluoride, then it's okay. But in Mumbai, at least fluoride toothpaste should be used. Proper brushing technique, like shown in the figure, the front of the teeth, the back of the teeth, in between the teeth, it all should be clean. Limit intake of sugar. This is important, especially for children, because sugars are sticky. Any sugar with sweet things are sticky, and then these sugars get stuck in between our teeth and gums. And for germs to multiply, it needs 3 things. One is adequate temperature, second is moisture, and third one is food. So these sugars provide food for the germs. So limit intake of sugars. Include food that contains calcium in diet like milk and yogurt. This will make our teeth strong. Now hair hygiene. Hair is made up of dead cells, so wash hair regularly with a mild soap or shampoo. Rinse hair thoroughly with clear water after shampooing to remove all the soap or shampoo. Do not scrub or rub your hair too hard. It may irritate your scalp and damage your hair. Massage your scalp well. It will remove dead skin cells, excess oil and dirt. Comb your hair daily and do not share your comb or brush with anyone. Wash your combs once a week. This is important because when we keep on regularly using our comb, the teeth of combs get dirty, dandruff may be there. It has to be washed. Tie your hair. Ladies, girls, those who have got long hair, the hair should not be kept open because then it may get dirty and may have dandruff. Coming on to ear hygiene. Now the question arises whether earwax, whether it should be cleaned out or not. Actually, even though earwax seems unpleasant, it protects the ear. So wash your ears daily with washcloth. Do not forget the areas, especially behind the ears. Now, do not use cotton buds in ears as they tend to push the wax deep into the into the ear canal, where it can get stuck. Similarly, never use pointed or sharp objects like hairpins, safety pins, or even your little finger into the inner ear canal. Many people have this habit of irritating their ear with little finger. This is also dangerous because it may lead to ear canal infections. Now, nail hygiene. Soften the nails in warm water before trimming. Do not cut nails shorter than skin level. Round your fingernails slightly when trimming them. Cut toenails late across. Smooth rough nail edges with a nail file. Nails should be kept clean by using bath soap, water, and brush. Food hygiene. Large collection of sweat glands are present in our food. Wash your feet daily. Dry them carefully, especially between the toes for fungal infection. Keep feet and skin clean and dry. Change socks daily. Avoid walking barefoot in public areas. Especially people who are diabetic should take care of their feet. They should inspect their feet, look for any injuries or any infections or any calluses or corn, and always maintain good food hygiene. Clothes hygiene. We usually have two layers of clothing. The internal layer is undergarments. These are right next to our skin and collect sweat and dead skin cells, which can stain the cloth. Bacteria grow on this dirt and produce a bad smell in addition to the specific odor of the sweat. Undergarments must be washed more frequently than the outer layer of clothing. Clothes hygiene is an important aspect of one's dignity. Now, what clothes we wear depends on many aspects, the socio-economic aspects and the cultural aspect. But whatever clothes we wear, it should be clean and tidy, it should be washed every day, and it should be ironed. Ironed for the destruction of body lice and nits. And if anybody is ill and if their clothes are to be washed, it can be washed in boiling water. Now, home hygiene. Sweep the floor once a day and wash it twice a week. Clean the cupboards, shelves, drawers in the kitchen once a week. Clean the kitchen platform and basin several times a day. This is important. We'll deal with this in food hygiene. Clean the bathroom and toilet twice a week. Wash clothes regularly and bed linen once a week. Hang clothes in the sun. It helps to kill disease causing. I know in Mumbai there is space constraint, but still, if you have got a balcony and there is adequate sunlight, make it a point that hang your clothes in the sun instead of drying them in the washing machine. Now, environmental or social hygiene. Environmental health. WHO defines it as all physical, chemical, and biological factors external to a person and all the related factors impacting behavior. It encompasses the assessment and control of those environmental factors that can potentially affect it. In short, environmental or social hygiene means anything that affects the man, whether it is physical, biological, anything. It also involves climate change. It's a broad definition, but for hygiene purpose, we can say that our surroundings should be kept clean. So until unless they are clean, we can't say we are hygienically healthy. Now, food hygiene. How food can make you ill? Any food can contain germs. Now, these germs are colorless, odorless. We can't see them through our naked eye. So any food that is brought has to be clean. Transferring germs to uncontaminated food. So the role of separation. Non-veg and veg food should be kept separately. Not cooking food properly. So food has to be cooked at particular temperature. We'll see this later. Inadequate storage. It has to be stored at particular temperature. This also we'll see in the coming slide. Sick or infected persons preparing food can make other persons ill. Now coming on to cleaning. As I said, diseases causing bacteria grow best when there are three things: warmth, moisture, and food supply. In ideal conditions, bacteria double their numbers every 20 minutes. For example, if a piece of meat infected with 100 food poisoning bacteria is left lying on a kitchen bench on a warm day, the bacteria will double their number every 20 minutes. And in 3 hours, the 100 bacteria will multiply to over 50,000 bacteria. Can you imagine? Just keeping a piece of meat in ideal conditions, suppose all the three things are met, and you watch a movie, and after 3 hours, that piece of meat will become a reservoir of bacteria. Hence, raw food items should be thoroughly cleaned using under running water. Ensure food preparation surfaces are hygienically clean before preparing food. Wash and dry hands after handling raw foods. Wash and dry hands before handling ready-to-eat food. Now, separation, avoid contamination. As I said, ensure raw food is kept separate from cooked food. Example, raw meat should be kept at the bottom of the fridge beneath ready-to-eat food. Keep a separate chopping board for meat, fish, and poultry. Immediately clean surfaces which may be contaminated by hands, food, or clothes. Do not leave it until later. This laziness will cost us very heavily. So immediately clean the surfaces. Wash utensils immediately after preparing raw food in hot soapy water. Rinse in clean water and leave to dry. Avoid preparing food if you are infectious. Now cooking, this is important. It is vital to cook food thoroughly. Always follow cooking instructions on food packaging. Note that frozen food takes longer to cook than fresh food. If necessary, frozen food should be defrosted in a refrigerator rather than room temperature prior to cooking. Cooking example, meat and poultry, whenever food is cooked, it should be cooked at maximum core temperature of 70 degrees centigrade. Cooling, whenever food is cooled at 5 degrees centigrade or cooler within 90 minutes. Reheating, whenever food is reheated, maximum core temperature of 70 degrees Celsius for 2 minutes, and hot food minimum core temperature of 63 degrees Celsius, cold food 0 to 5 degrees Celsius. Now, what does these temperatures mean? If you look adjacent, there is a diagram where you can see there is a danger zone between 4 degrees Celsius to 60 degrees Celsius. Now, what is this danger zone? If any food is kept in this temperature limits between 4 degrees Celsius to 60 degrees Celsius, bacteria grow rapidly. Therefore, any food that has to be consumed hot has to be consumed above 60 degrees Celsius, and any food that has to be kept or eaten as cold food should be refrigerated below 4 degrees Celsius. Any food that has to be stored as frozen food should be stored below minus 18 degrees Celsius. If you want to reheat, then the reheating should be done above 70 degrees Celsius, and reheating for 2 minutes kills most of the bacteria. So hot food minimum cold temperature of 63 degrees Celsius and cold food 0 to 5 degrees Celsius. Hot food should be kept hot for a maximum of 2 hours if not eaten immediately after preparation. Serve food as soon as possible after cooking. Now, food hygiene. Children who are watching, please concentrate on this slide. Do not eat street or open food. Do not drink raw milk. Do not drink fruit juices from outside, as 90% of the ice served in roadside shops and small hotels have shown growth of E. coli and E. coli bacteria. Check for outdated food, packaged food with sealed broken cans that are burned. So any can which is tampered should not be consumed. Now diseases. What if we do not remain in hygienic condition? We get diseases. There are few diseases which I will be talking about. One is water or foodborne diseases. Most common is diarrhea. Now, what is diarrhea? Urgent need to use the toilet. That means increased frequency of motion. If the frequency is more than 3, we label it as diarrhea. More than frequency is the consistency. That is loose, watery stools. Then other symptoms may be pain in the abdomen, frequent bowel movements, nausea, bloating, fever, weight loss. Most important thing to look here is to avoid dehydration. So for dehydration, drink more water, eat watery fruits, drink freshly prepared fruit juices like lemon juice, coconut water. You can use OIS, which is now readily available in the market. If you don't have OIS, you can prepare OIS at home. Very simple procedure. Take 1 liter of boiled water, add 1 teaspoon of salt and 6 teaspoons of sugar. Stir it and consume that solution, and see to it that that solution is consumed within 24 hours. Most important thing is the balance between sugar and salt. Don't eat too much of sugar because that will increase the frequency, what is called as osmotic diarrhea. Typhoid fever. Now, typhoid fever is caused by Salmonella typhi. It is caused due to ingestion of contaminated food or drinks. Symptoms are fever, malaise, abdominal pain, diarrhea, or constipation. Hepatitis A and hepatitis E similar symptoms: jaundice, fever, dark urine, dark stools, nausea, vomiting. Basic treatment points are: eat enough calories, take plenty of rest, drink plenty of fluids, avoid medicines that can harm the liver, and avoid alcohol. Now, waterborne disease, how to prevent them? Drink only clean and safe water, either potable water or water filled through water purifiers. Get water purifying devices like filters, RO unit, etc. regularly serviced and maintained. This is important. It should be regularly serviced. Ensure proper storage in closed containers so that stored water is germ-free. Proper hand hygiene, which we have talked about. Proper food hygiene. Etc. Sanitary disposal of human waste. Now, vector-borne diseases quickly. There are 2 important diseases: dengue and malaria. Symptoms: dengue, high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, nausea, vomiting, skin rash. Same symptoms of malaria: headache in case of cerebral malaria, fever, fatigue, pain, dry cough. Now, how to prevent vector-borne diseases? There are three things. First, reduce the source where mosquito can be. Stop breeding the mosquito. If mosquitoes are breeding, second, kill the mosquitoes or larvae. And third, your personal protection. So let us see quickly one by one. Reducing the source where mosquito can breed. Don't allow water to remain stagnant in and around your house. Clean the block drains. Empty room, air coolers, and flower vases completely at least once in 7 days and then refill them. This is important, especially when we see peak in dengue and malaria cases. This should be done judiciously. Clean that. Do not forget to clean the tray below the fridge. Dispose of cold containers, tins, and tires, etc. Keep the water tanks, water containers tightly covered so that mosquitoes cannot enter them and start breeding. Now, killing the mosquito and larvae. Introduction of some type of fish like Gambusia, lobster, which eat mosquito larvae in water bodies. This can be kept at home in our aquarium or fish ponds. Pouring oil over the water source, spraying of DDT, malathion, and pyrethrum, etc. Spraying all over the walls of the house, behind the photo frames, curtains, calendars, and corners of them. Basically, this is done by local health authorities like GMC. If they come to your house, please allow them and make it a point that all these areas which I have mentioned, their spraying should be done. Now, personal protection, wear clothes which cover the body as much as possible. Sleep in mosquito net. Use mosquito repellents like sprays, creams, oil that is easily available. Coming on to airborne diseases. Now, COVID is an airborne disease, as I told about the droplet infection. Now, influenza and swine flu, bird flu, these are all flu types. When we have fever, cough, sore throat, muscle ache, headache, fatigue. The difference is bird flu is due to close contact with the birds, and swine flu is due to close contact with pigs. And then we see human to human transmission. Tuberculosis symptoms are persistent cough, weight loss, then fever, especially evening rise of temperature, night sweats. These are common symptoms of tuberculosis. Now, COVID. We have all undergone this COVID. We have faced, in fact, COVID wave. Last wave was the Delta wave, and the ongoing is Omicron. Now, what is the difference between these two waves and flu and cold? The basic difference which we saw in the Delta wave was shortness of breath or breathlessness. So the importance of pulse oximeter was there. But this shortness of breath, many a time patient did not realize that his oxygen saturation is dropping. That we used to call it as happy hypoxia. In Omicron, such thing is not observed. One more thing which we observed in Delta wave was loss of smell and taste sensation. Whereas this is absent in Omicron. The other symptoms are common like running nose, sneezing, sore throat, cough. In cold and flu, most symptoms are of nasal things like running nose, sneezing, cough, etc. There is no loss of taste or smell sensation or shortness of breath in cold. Now, coming on to airborne prevention, airborne disease prevention, practice hand hygiene, which we have already seen, respiratory hygiene, which we will see later, avoid close crowded spaces, maintain distance 1 meter, that is 2 gaj ki duri, and mask hai jaruri. Refrain from touching face, nose, mouth, and even mask, and use proper mask. Coming on to respiratory hygiene, turn head away from others when coughing, sneezing, cover the nose and mouth with a tissue. If tissues are used, discard immediately into the dustbin. Cough, sneeze into sleeve if no tissue is available. Clean your hands with soap and water or alcohol-based product sanitizer. Do not spit here. And these are simple respiratory etiquettes, but it has to be followed every time. Now, coming on to masks. There are three types of masks. One is the cloth mask, the second one is protective mask, the third is the N95, which I think is hidden by the camera. Now, this simple cloth mask, it's not a filter, it just prevents dust. So it is less protection from COVID-19. Surgical mask, or what we call as 3-ply mask, this stop droplets. It is recommended for patients who are coughing or who are in close proximity. N95, these are the best masks because they filter more than 95% of particles or pathogen down to 0.3 microns. Now, how to wear mask? Simple procedure. First, clean your hands and hold the mask by the ear loops and place the loop around your ear, mold wrapping the stiff edge to the shape of your nose so that there is no gap between the nose and the skin. Pull the bottom of the mask over your mouth so that nose and mouth both are covered. Avoid touching the front of the mask when wearing, and then again wash them. Similarly, while removing, clean your hands. Avoid touching the front of the mask. Only touch the ear loops. Hold both the ear loops and gently lift and remove the mask and throw the mask in the dustbin, and again clean your hands. As I told, there are different types of masks. So which mask is better and which mask should be used, especially during COVID times? So there is complete no to cloth mask. It's useless. Even no to mask with valves because this may transmit germs. No to bandana or scarf or any handkerchief. What we can use is surgical mask, yes. And if you want to use mask as a fashion statement, like it has to be fashionable with your clothes, then you can wear those masks. But under that mask, you please wear surgical mask. That is called a double mask. Now, all diseases are vaccine prevented. So there are vaccines. So which are they? Typhoid. Typhoid vaccine, one dose every 3 years. Hepatitis A, two doses at 0 and 6 months. Hepatitis B, three doses at 0, 1, and 6 months interval. Varicella vaccine, two doses at 4 to 12 weeks interval. TD or Tdap, one dose every 10 to 12 years, especially TD can be taken. MMR, two doses at 4 to 8 weeks interval, and HPV in females, three doses, 0 to 6 or 0, 1, 6, depending upon the type of vaccine we are using. Now, COVID vaccines. Now, I think most of us have taken COVID vaccines. Presently, there are three COVID vaccines available in India. First is the Covishield, two doses at an interval of 12 to 16 weeks. Covaxin, two doses at an interval of 4 to 6 weeks. And Sputnik V, two doses at an interval of 21 days or 3 weeks. Now, Government of India has recently started the precautionary doses for all persons over 60 years, for healthcare workers, for frontline workers, on completion of 9 months, that is 39 weeks from second dose. Doses for children have also started, aged between 15 to 18 years old, that is whose birth year is 2000 or before. Covaxin presently is given. Recently, Drug Controller General of India has approved two more vaccines, Corbevax and Covovax, for emergency use authorization, which we may see in near future. Now, in spite of taking vaccination against COVID, we should need to follow these five. Now, what are these five? Which the Government of India emphasizes? It is COVID appropriate behavior even after vaccination. What are they? First, use masks correctly, as I told you. Wash hands with soap and water frequently. Maintain 6 feet or 2 gaj ki duri. If you see any symptoms, prompt self-isolation. If you do have symptoms, please test yourself. Now, take home message, it is wash. What is wash? The importance of hygiene and sanitation cannot be realized with water. Water, sanitation, and hygiene are collectively termed as wash. Water, sanitation, hygiene. Since water and sanitation, hygiene are interdependent, therefore are grouped together as one. Therefore, water is truly called Jal Hi Jeevan Hai. Washing the hands with just take 20 seconds can prevent as many as 200 diseases. I am emphasizing this point again and again. Take timely vaccination. There should be no vaccination hesitancy. Follow the five COVID appropriate behavior I discussed in the previous slide. Even after COVID vaccination, use proper mask and wear it properly. Thank you. And finally, I would like to say that the saying goes, "Sabun se haath dhoiye aur na ki zimmedari se." So it is our zimmedari or responsibility as the responsible citizens of India that we follow proper personal and social hygiene. Then only we can say we are successful in celebrating this Swachhata Pakhwada. Thank you very much. And again, thank all of you. Thank you.
Thank you so much, sir, for your detailed lecture on hygiene. Really, it is very helpful to each and every one of us. Now I request Dr. Gurpreet Kaur Madam to deliver her lecture on hygiene.
Good afternoon, all my seniors, higher officials of HPMR, and I will say a very good afternoon to all those who are listening to this lecture. I thank Dr. Umesh for an elaborate lecture before me. And also you will see that there are two names in this presentation because I have come in place of Dr. Sonali Shejul at the last minute. So my slides are few and my talk will be limited, but I'm more welcome to the questions of the audience. So let's start. What is promotion of good health? Now, for the students and for everyone, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Most of the time, we think that it is only the physical health, but let me be very clear that it involves mental health as well, which most of the time is neglected. Now, as you can see, that the world's leading causes of death, that people are dying in millions, has increased from 2000 to 2019, mainly because of ischemic heart disease, means heart disease. Secondly, stroke, chronic obstructive pulmonary disease, lower respiratory infections, neonatal conditions, trachea, bronchus, lung cancers, Alzheimer's disease, and other dementias, diarrheal diseases. So we need to think that why heart disease and stroke are mostly common, mainly because of our lifestyle. Now, what are the lifestyle habits which we can change? These diseases are something which we are inviting ourselves because as now, because of COVID, we had a lot of restrictions. We don't blame anybody. We were all in lockdown. We were scared. We were scared of death because we don't want to get exposed to the COVID. We heard so much news. People are dying because of COVID. So everyone was restricted inside. But what has happened in return? We somewhere, I agree myself, have gained weight. So we need to come back to normal. We need to consider back that we have to come back in shape, not only because we want to look good, because we want to prevent all these negative effects of obesity on our health. Now, what happens with obesity? Not only it causes the incidence to increase of heart attack, depression, type 2 diabetes mellitus, high cholesterol, but you won't believe bone problems. Now, somebody will say how obesity is affecting the bones. As very well said by an orthopedician, when you gain 5 kg weight, you are actually putting a weight of 15 kg on your knees. So the incidence of knee replacement has increased. Our setup is good. We are providing to our patients, but not everyone is so lucky. So we have to have our normal joints. We have to have our normal heart. We don't have to live with all this. Now, what are the medical complications of obesity? As I have said before also, first of all, when the weight increases, it increases the blood volume and indirectly it increases the heart load. So which leads to coronary heart disease. Now what happens when your body is not able to bear with that excess weight? It is naturally going to affect your heart and the circulation will be impaired and you will get hypertension plus you will get dyslipidemia. What is dyslipidemia? It is nothing but the fat which is collecting in the blood vessels which leads to heart blocks and stroke and death also. It also increases the incidence of non-alcoholic fatty liver disease, pulmonary disease causing obstructive sleep apnea. The person is sleeping and suddenly we heard he died in sleep. But nobody knows why. Because he was not able to get the proper oxygen. Gynecological abnormalities seen in small kids, POCD. Why? Because the fat is accumulated and your normal cycle is not being regulated. Phlebitis, cancer of breast, uterus, cervix, colon, esophagus, pancreas, kidney, prostate, severe pancreatitis. So this is another reason why we need to be very particular about our weight. WHO recommends that at least 150 to 300 minutes of moderate intense aerobic physical activity should be there, or at least 75 to 150 minutes vigorous intensity aerobic physical activity is there. Now, in this lockdown, most of the people complain that we were in the lockdown. But it's high time now we are aware that we have come to realize how to prevent COVID. So we should start back with our normal routine. Of course, if you cannot go outside, you should make it a point to start walking inside your house, inside your corridors. Now, this fancy watch which I'm wearing is not a watch. It gives me an idea how many footsteps I've put. So when I walk, I realize in the whole day I was sitting on the chair working for 8 hours, but at the end of the day I walked only 1,000 footsteps, whereas I need to walk 10,000. So I don't suggest that everyone wear watches for this. This is just for a reference I'm showing it. But that's the way. You should have some way to keep you reminded that yes, I need to do some physical activity. Sitting is a new smoking. Now, for the kids also, I will not blame. Schools were closed. So there was no activity. Online classes were going on. But what happens? When you sit, you use less energy than you do when you stand or move. Research has linked sitting for long periods of time with a number of health concerns. You might start by simply standing rather than sitting when you have the chance, or finding ways to walk while you work. For example, take a break from sitting every 30 minutes. Stand while talking on the phone or watching television. If you work at a desk, try a standing desk or improvise with a higher table or counter. Walk with your colleagues for meetings rather than sitting in a conference room. Regular exercise, weight control, healthy dietary habits, good sleep, avoid stress, anger, alcohol, smoking, and tobacco chewing. These are the lifestyle modifications which can help prevent the main diseases like heart disease, diabetes, and hypertension. Salt. You should also reduce your salt intake. WHO recommends less than 5 grams per day. Oil. What is the best cooking oil? People many times ask me. There is no such best cooking oil. You have to just keep on changing from rice bran, sapola, whatever. And maximum you can use is 500 ml per person. For that, we need not elaborate. Ladies are there, they know how to cut down the oil intake where it is not required. Physical health cancer screening. Cancer screening means checking your body for cancer before you have symptoms. Getting screening tests regularly may find breast, cervical, and colorectal cancer, prostate cancer early when treatment is likely to work best. So, we are actually fortunate that we have a very good CHS system, and wherein when you regularly visit the dispensary, it is done at a regular basis. Why? Because the metastasis is not there and the life expectancy can be increased and the complications can be. The lung cancer screening is recommended for so many people who are smokers. Also, drugs. Many people are addicted to drugs. So, drugs, especially alcohol, can be the worst. And there is a list of drugs which nowadays, at least because of awareness, has decreased in my experience. These are the mainly side effects of alcohol and smoking. Now, what happens is that you get addicted to smoking. Whenever your nicotine is present in the cigarette, the level decreases, the brain generates a crave for it, and it releases dopamine, and again you feel like having. So, it is better to quit smoking. Tobacco smoking can cause depression, myocardial infarction, sorry for the poor slide, and then lung cancer, especially emphysema and lung disease, and also oral cancer. See, this is a normal lung, and this is how the lung becomes after smoking. It has also been seen, some people ask, I have been smoking for 20 years. What if I stop? Yes, it helps because it has been noted that within minutes of smoking your very last cigarette, your body begins to recover. According to the American Cancer Society, 20 minutes after quitting, your heart rate and blood pressure drop. 8 hours, oxygen level improves. 1 day, the heart attack rate reduces. 2 days, taste and smell improves. 1 month, the respiratory problem lowers. Within 1 year, your lung health improves. 3 years, your heart rate attack is decreased. And 5 years, lung cancer rate is decreased. And 10 years, lung cancer is as good as non-smoker. So stop now. See, this is a diagrammatic picture wherein actually it shows how the smoking active nicotine activates the dopamine transmission. This is what is the end of the smoker. This is a picture of a cigarette, and these are the components whereby you can see how dangerous and how bad it is for our health. Now let's talk about mental health. Stress is not what happens to us, it is our response to what happens, and response is something we can choose. Very rightly said by somebody, because we all may be passing through one phase, but how we react depends on our thinking. So, what is important that your mental health should be good? What are the factors which affect your mental health? It includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Now, how do you have a very good mental health? First of all, you should learn to share your feelings, especially for kids. Don't hide facts from your parents, especially when the growing phase is there, adolescence is there. You may feel certain thing which is abnormal for you, maybe a normal physiological response, and you should share with your father or mother, depending on your sex, and tell them exactly what you feel. Keep yourself active. It has been seen that people who walk regularly, endorphins are released, which are antidepressants. Eat well. When you have not eaten well, then also you become cranky, especially in the kids or even in the adults. You're busy in the work and then you don't realize you're getting angry for no reason. Keep in touch with your friends and family members. Take a break. All work and no play makes Jack a dull boy. So do something you're good at. Abstain from alcohol and smoking. Physical health, adequate sleep is an essential function. 7 or more hours of good quality sleep, which hardly we do it because now everyone is addicted to the mobile, WhatsApp, and TV. But it is must that you should have 7 hours sleep. Regular schedule, because there is something called as a circadian rhythm, like it's a clock in our brain. So exactly at that time your body wants to have food, your body needs sleep, body and mind to recharge, refresh and alert and stave off disease. Now screen time. As I told earlier also, because of the lockdown and COVID, everyone was restricted nothing but to the mobile. But it's high time we break it. Take frequent breaks while using digital devices. Use the 20-20 rule. For every 20 minutes of usage, look away for 20 seconds and focus on something 20 feet away because you are having eye strain. Screen time also causes obesity because you are so addicted to that particular video or program that you don't want to get up. Your mom is calling, but you will say, I just want to finish this video and come. But that's wrong. It will lead to obesity, inadequate sleep schedules, and insufficient sleep, behavior problems because you don't know what your kid is watching on the mobile. You're thinking he's watching some useful thing, but internet has no limitations, so be careful about it. Delays in language and social skill developments, violence, because as I said, we don't know what our kids are watching. Attention problems, because they are totally glued to the mobile and the TV, of course. What is stress? It is understanding and management, a way of total well-being. This is a Hindi slide, why diabetes happens. Because there is insulin deficiency, or sometimes insulin is present but cannot be used properly. So this is the addiction cycle, wherein first there is attraction, fantasy, then it becomes a ritual, a habit, then you start doing it regularly, and then it becomes a shame, and it starts all in your mind. So you need to control your mind. It's all in the mind. What are the healthy habits I can suggest? Quit smoking, begin exercise, eat healthy. So, one of the factors I elaborated is quit smoking, quit alcohol, because this is an actual picture of a tobacco cancer patient. Cancel Lala? So healthy foods, mainly fruits and vegetables. Avoid sweets, fatty foods like butter, non-veg in a limited quantity. And of course, you should be very particular. Don't eat burger, junk food, potato chips, which kids normally enjoy. Fresh fruits can be accumulated in your diet and they are very good for everyone. Wine should be avoided. So, what is your regular dose of medicine? Medicine should be a happy pill, which should include exercise, laughter, vegetable, fruits, good sleep, gratitude. You should be thankful for what you have rather than being what you don't have. Love your family and be better to take this pill daily. So, thank you everyone for giving me this occasion to talk on lifestyle modification.
Thank you so much, madam, for your detailed lecture. It is very well useful for all of us. Thank you so much once again, madam.
Request you to give a talk.
Yeah, I have some questions. Dr. Umesh, you covered very nicely and really useful for especially the kids or school kids. Wonderful. Only I think that I don't know whether I need eye care for.
Yeah, I can have covered the screen time and also I did not wanted to repeat it again and again. Purposefully, I deleted that. Otherwise, I would have been repeated repetition that
Okay.
most important thing is screen time. Because in COVID times, that's why I did not.
Thank you very much because Dr. Sonali Shejul had some personal problem. I came to know from the morning and you have taken care that in her place. That is really, really, we are so happy. So thank you for your.
My pleasure. That's why I said that my slides are full and if anybody has any questions, of course.
And I just want to tell one thing. Probably we had some of you probably have faced link problem. If you have or any of your friends have missed it, they can view it in the YouTube. Go to HBNI site YouTube. HBNI has a YouTube channel, and you can get it. And probably that link directly is not working. I checked that link had some problem. One has to type it. Whatever the link was given, that one has to type it. It was not directly. It was not working. So with that, one can see even YouTube in at any moment. It will be available all the time. Yeah. If you have any questions, anybody has questions, you can raise your hand and we can put up to the doctors, experts here. So. Yeah, but which comes
Yes.
Yeah.
You are comfortable. So we were trying to.
No, that's fine. You people who are the people. Who are the ones. Yes. Yeah, anybody else? Again, you can announce.
I request you that any one of you have got any questions, you are requested to ask the same. Our doctors are ready to answer to your queries. Kindly.
You can type also in the chat.
Yes, ma'am.
You also can type on the chat box if you have any query or any advice.
YouTube. I have checked that. More than 100 are attending the YouTube. And they cannot ask directly question. They can type in the chat box.
Yeah.
YouTube chat box can do like this. I've seen more than 100 people are attending.
Can you tell how to treat worms in stomach?
Very good question.
Yes, treating worms, there is something called as deworming, which we can do albendazole. It can be taken every 6 months. And if you have got frequent stomach problem, it's better to consult a doctor. We but in general terms, Government of India also propagates this, taking albendazole tablet once in 6 months.
to avoid eye problem. Somebody else.
As I said that you are supposed to take a 20-20 break. And suppose you have a genuine, like you have an ongoing class, you need to turn away, look again 20 feet far and give a rest of 20 seconds is enough. Continuously watching and how much distance you are placing your mobile, what is the screen distance, that is more important. So, and you can have a, like, of course, it is said that, splash normal tap water in your eyes, that also gives a cooling effect, and sleep well for 7 hours. Don't overstrain. When you feel tired, you need to take a break and then restart. And you should go for a regular checkup because it is seen that by end of the day you realize, means after a long time, that oh, my number has become 3 or 4. So once in 6 months or once in a year, it's better to go for a reflection error checkup. How to be healthy and disease free.
Whatever the lecture so far given, we should follow.
Yeah.
Again, see the.
See, what I said was healthy is not just, even Madam emphasized, not only physical health, it is mental health, it is social health. So eating proper food, taking proper sleep, meditation, being stress-free is all is needed to be healthy.
You should
And-
ideally sleep before 11 p.m.
Definitely.
Because they say that what sleep you get between 11 to 12 is equivalent to your full night. There is a sleep pattern. Those who are studying science, that non-rapid eye movement and rapid eye movement. So that is the time actually you need to go to sleep.
Yeah, definitely. Using sanitizer does affect skin. Suppose the people who are sensitive to sanitizer, they should avoid it. They should frequently use soap and water. Some people do have allergy for soaps also that I have seen, because frequently washing soaps also cause the skin allergies. So the recommendation is, important thing is in preventing these allergies to see for the pH value. See, our skin has a pH value of around 5.5. So when you go in the market and buy some soaps or sanitizer, please see to it that it is skin pH friendly at around 5.5. Then you won't get those allergies.
How many hours do we need to sleep? At least 6 to 7 hours. And also, it is said that those who can take an afternoon nap, that also prevents the incidence of heart disease, because your heart is also pumping continuously, your brain is also working continuously. So those who are studying and have the privilege to take a half an hour nap or just lie down and relax, that will be the best. For allergic cough, you will know better because what you are taking. See, it depends, like some people are allergic to cold, some people are allergic to pollen grains, some people are allergic to dust. So whenever your allergy increases, you have to focus on what you have eaten and not.
I would like to add one more thing, that allergic cough, follow COVID appropriate behavior. We have seen by just using mask, many of the patients come and say, sir, I had this sinusitis attack, I had this thing. All these allergic have decreased just by wearing mask. So for prevention of allergy, use mask.
Yes, a sanitizer can affect your skin. I myself am my example. So better to use a simple soap and water.
Yeah.
Frequent sanitizer can really damage your skin. How to get good sleep? Best is that avoid any TV or mobile just before sleeping because it activates your brain. So when you are watching late night movie or you are watching some YouTube program on the mobile, you start thinking about it and your sleep gets disturbed. And as a matter of fact, spiritual health. If you pray for 5-10 minutes, or they say as a shavasana, yoga, if you can do that, then you have to just relax your mind and body, you will get a good sleep. That's it.
Which mask is good? As I told, N95 is the best. N95 without valve, but it's expensive. Also, surgical masks or 3-ply masks are also good.
Peanut allergy.
Okay, avoid
How can I reduce my
Okay.
allergy with peanut?
See, avoid it, that's the answer. Because if you are allergic to something, you need to avoid. Like when you go to a doctor, the doctor does ask you, are you allergic to any medicines? Why? Because then he will not prescribe those medicines.
How breathing problem, how to wear mask.
Breathing problem.
Aruna.
That means while wearing mask, they may be getting
Acha,
breathing problem.
In fact, breathing problem decreases with mask. You should wear it properly. That's why I emphasize on proper wearing of mask, not to clinch the hard portion of the mask too tightly or not too loose. It should be proper fit so that you can breathe it properly.
See, actually, here I like to also add that like now we are sitting in a group of people and in a closed AC room, so wearing bubble mask or single mask is important. But when you are sitting alone, you need not wear a mask. It can add to your breathing problem.
Yes.
You will feel suffocated at the end of the day. So it is not necessary that when you are sitting alone, you need to wear a mask.
Yes.
You should always remember that. Yes.
Accumulation.
You can avoid cough accumulation in the night by taking plain steam inhalation and avoiding cold food, ice creams, refrigerated food. So if you have a tendency for cough in the night, you better take steam inhalation. Suggestions before sleeping. I said you should not watch any.
No. Just think about cough accumulation before sleep. But
Avoid
I think you have answered.
Yeah.
cold refrigerated food.
Steam inhalation.
Yeah, steam. The second year we started using it. It is not necessary to wear two masks for everyone. See, we are doctors and we are seeing a patient crowd. We are seeing ill people wherein we don't know the status. So we come across 50 to 100 patients per day in a heavy dispensary. Plus we are traveling. So we don't know. So as a matter of fact, we are wearing two masks. But those who are sitting comfortably alone and working with few people around can wear single surgical mask is equally good.
How can we
Know which soap is best. Glycerin soap is good for skin, as told by the
As I
dermatologist.
told, I think I have answered this. Which soap is best? See, any soap, our skin pH is around 5.5. So any soap which is matching with the skin pH is best. Whatever soaps available in the market have pH between, say, 8 to 10. So don't use any soap which has pH more than 11. It will start spilling your skin. So any soap between this range is good for babies, especially the baby soap. They have very low pH, around 7, 7.5. If you have got any skin diseases, then you consult a doctor, then they will advise you about exact pH of the soap. But for normal general population, any soap between pH 8 to 11 is very good.
Taking regular plain steam affect the lungs. Taking regular plain steam, I don't think it has any bad effect on the lungs because you're not adding any medicine. It is not going, it is just plain water. So it is just going to increase the circulation of the lungs and help you bring out the sputum. So that will give you a good, breathing capacity. How to get rid of sensitive teeth.
Before that, there is a question. How to manage blood pressure?
Where is it?
Mr. Viva Singh.
How to manage blood pressure. As I said that first is weight. When your body weight increases, you are adding to the volume of the blood. So as soon as the volume of the blood increases, the pressure the blood has to face while passing through the blood vessel is nothing but the pressure. That is the blood pressure. And you have to restrict the salt because salt causes retention of water in our body. So that is another way. Secondly, thirdly, stress. When you are stressed, suppose you have not slept and you are thinking, you have fought with somebody, it's bothering your mind. So all you need to do is forgiveness is the best revenge. So just leave it. And of course, genetics. Genetics is there which you can't help, but then regular monitoring of blood pressure and walking walking also helps. So, and vegetables are included in the diet, avoid non-veg, avoid oily foods. So that helps you manage your blood pressure.
How to get rid of sensitive teeth? Proper dental hygiene, as I told, brush your teeth after every meal, if not possible, do rinsing, flossing. Uh, Avoid sweet food because, as I told, it gets stuck and causes sensitivity, caries, and cavities. If you have caries and cavities, then it's time to consult a dentist.
See, for sensitive teeth, let me share, my father was a dentist. So we were taught that you are supposed to at least brush twice, morning and before sleeping. Because what happens most of the time when we are eating food in the night, we never remember, and the bacteria or whatever damages your teeth and nerves get irritated, and that causes the sensitive. So if you have a carious tooth, you better get it treated so that the sensitivity decreases. You have to consult a dentist for that.
Yes, yes, definitely. You can prevent sensitivity, but once it is there, you need to consult a
You
dentist.
have to treat it.
Digital detox.
Huh. And can you tell us about digital detox and health? Digital detox.
Screen cancer.
See, basically, you have to interact. You have to go back before 2 years, how the children were playing outdoor games and, indoor games like carom, badminton. It is not necessary that you give them mobile only. Of course, when we are tired, when we go home, we ourselves give the mobile to the child. Okay, you can watch this poems. Meanwhile, I finish my list. So you have to inculcate good habits. You have to develop your stamina. Go out with your child for a walk in open spaces. Mask, people say wear mask, but I say that don't wear a mask while walking because it reduces your oxygen intake. The incidence of cardiac arrest increases. So wearing mask is good, but not especially while walking. And digital detox is that you have now the classes are started, schools are gradually starting. We have overcome the fear of COVID. We know that it is almost being cured. Vaccines have come. So you have to get back to your normal schedule. There is no other way. How to clean ears.
See, when you are having a bath, that time after cleaning, after having a bath, just with wet cloth, you can just clean the outer surface of the ear, behind the ear. No need to remove the wax. It should not be crystal clean and clear because wax, as I told, is a protective mechanism. If there is too much of wax, it is irritating, then it need to consult ENT surgeon, then they will do the needful.
How to reduce your weight and can skipping meal will help? No. Skipping meal will increase your appetite after some time and you will have a binge eating. Better to substitute your meal with healthy food. Instead of sweets, you have fruits and vegetables. If you have a craving for eating sweet, you have a banana because its calories are low. Like if you want to check the calorie chart, a gulab jamun is having more calories than a laddu because it's fried. So these are the small things which you need to concentrate while eating. And of course, you have to do regular walking and exercise.
I would like to add for weight reduction, you should know your ideal body weight. Ideal body weight should be 100 minus your this thing.
BMI,
BMI. Yes, yes.
body mass index,
Yes.
weight divided by height in meter square is your ideal body weight minus 100. Depending your height, your body weight can be decided. Vary. There is a full chart on it wherein less than 23.5 is the ideal body weight. BMI should be there. And 40 is the morbid obesity where you need to go for a surgery also. Can neem kill worms? Actually, all our seniors have been propagating. Even I don't know, but they say if you eat neem, it really helps.
Yes.
Neem, karela, methi. Something which even I don't like, but it will be included in the diet.
Yes.
There's a process of sanitization. Nothing 100% we can't guarantee, but yes, most of the germs are killed.
How to get rid of ear wax, which is increasing very much after 2 or 3 days.
See, this is not normal increasing 2 or 3. You need to consult ENT surgeon.
Still. Hard water is known to cause hair loss, as per my information.
Yeah.
And of course, the shampoos which you use.
Yes. It should be sulfate free. Most important, if you go in the market, it should be sulfate free. It should not contain any sulfate component, chemical wise. Any shampoo is.
Hair coloring should be avoided. Many kids have a fantasy nowadays for hair coloring. Avoid that.
Yeah, thank you.
On behalf of New Zealand, on behalf, this is a small token, just a memento from HBN.
Thank you, sir.
Yes. Thank you for giving this once my talk. On behalf of New Zealand, on behalf.
Thank you so much. Thank
I
you.
think we should organize every year such a.
Yeah.
Because a lot of, even for us, you know, I wish I would have learned better from my childhood, this kind of information would have been very nice idea for. Yeah. It was a wonderful.
Our pleasure, sir.
Our pleasure.
Thank you, sir.
You have to wake up to go.
Staying, harnessing, harnessing.
But I will go for duty.
Okay.
I'll be taking a Uber. No problem.
Okay, let's see that.
Thank you.
No, actually, Dr.